Hello and happy July 16th. I am Michael Ramone, your state representative for the 21st Representative District with your community report. The numbers are out and we are up to 143,383 people that have been tested for COVID in Delaware. 130,338 of them have tested negative. 13,050 have tested positive. 5,904 of them are in Newcastle County. We currently have 981 of the positive tests were probable. They never actually got tested for COVID, but they believe to have had it. 12,069 were confirmed tested positive, and 1,156 of those were in long-term care facilities. We are up to 521 deaths, which has stayed pretty constant now for over a week. We had 463 of those deaths that were positive and 58 of those deaths that were considered probable. 333 of the deaths were in long-term care facilities. If you do the math, that means 25% of the deaths in long-term care facilities were never actually tested positive for COVID, but 75% were, and they actually had COVID. The hospital capacity right now, we're at 98%, which means we have over 2,300 available beds if needed, if we had a COVID outbreak. Currently, we have 51 people in our hospital beds with COVID. Out of those 51, 11 are in critical condition. Suggestions of a new bump that we were going to have as a result of the outbreak, once again, of positive cases in Sussex seem to never have happened. Of course, we had an outbreak in positive cases, but it did not affect our hospitalization levels in any reasonable concerning measure. It did not at all impact any particular one hospital that would not be able to take anyone else in as a result of the positive tests. So the outbreak that everyone was suggesting would happen in the next 14 days was never actually realized. We are now at 23,281 21st Representative District constituent people that live in the 21st Representative District. Out of those 23,281, none in the 21st have passed as a result of COVID. And we had in the last day 0 new COVID tests, new COVID confirmations. So no one has tested positive in the last 24 hours, and we have no deaths since the beginning of the COVID outbreaks in the 21st District. Since the beginning, we have had 219 people total test positive for COVID in our 21st Representative District. 3,028 were tested, so that means 2,809 were tested negative and 219 had tested positive. So the summary of all those numbers, 10% of those tested for COVID positive, 90% of those tested were COVID negative. 0.3% of those tested have passed in our state. The hospitals and the critical care levels are at the lowest usage since the outbreak of COVID, and we started recording the numbers. The largest amount of positive COVID this month was the largest amount of COVID positive tested this month resulted in the least number of people going into the hospital in a month since we started keeping track. So the point is, everyone's concerned with the outbreak of people testing positive for COVID. Once again, we are not here to cure COVID and make sure no one tests positive for it. What we're here is to manage the COVID outbreak so that if our hospital beds are at a point that we are at capacity levels, we have to do something to be able to accommodate those who get sick. Right now, with 98% availability in our hospital beds and us having such a wonderful result in our ability to manage the COVID outbreak, I think our businesses, our people, our constituents, our children, our families are doing an excellent job, especially in the 21st. As I keep saying, there's 41 districts in Delaware. The 21st is amongst the top districts for the least amount of deaths, the lowest level of outbreak, and the highest level of positive results. So thank you, residents of the 21st. We're doing a remarkable job. The conclusion: more testing, more means more people will test positive. more testing and more people testing positive with less hospitalizations or even consistent hospitalizations and less critical cares or consistent critical cares or less deaths or consistent deaths is exactly what we need for us to be able to continue to manage this outbreak. So it's managing a crisis, not curing a disease. We cannot cure COVID by how we act and what we do. We need science, we need testing, we need a viral cure that would help give everyone the antibodies they need that will make them more resistant to catching the COVID outbreak. So our community update, it's kind of interesting what we have done to date. We had emergency cards, of course, always out there. I had given them out for the 12 years that I've been elected, and they all have my cell phone on them. The good news is you can get me when you need me. The bad news is I never expected an outbreak like this where so many people would need something at the exact same time. But I think we've managed it well. I hope I've done my best to respond to everyone. And if there was ever anything you did not get a response to, please contact me again. But our staff has been doing the best they can to try to resolve every single issue, whether it's unemployment, whether it's businesses, whether it's sole proprietors not getting their unemployment checks, whether it's people having needs. We did set up food drives for the food bank a couple times. We've done the PPE drives for Donate Delaware. The Meals on Wheels has been wonderful. We did the Boxes of Hope with the Parkview Assembly of God Church. All these initiatives in the 21st, I think, is helping us maintain and get the results we've been getting. We had a 21st crisis response team that we could go right to people who needed us. I believe one of the biggest failures that we've had so far as a government in Delaware is how poorly we did with the long-term care facilities and our senior community who live in those cluster environments. But even also, we have still not, but we've done a good job of resolving that now, but we still have not addressed all those seniors who live in their homes who aren't getting the care they need, and unfortunately, because of the quarantine environments, aren't seeing their family to get the care that they normally get either because of the challenges with this particular virus. The communications we've initiated with the daily reports, the Sunday Zooms, the e-blasts, the Facebook Live, the Zoom events. There were so many numerous Zoom initiatives for the small business and through the Division of Health and Social Services. And now we're doing the town halls, which we did our last one with Michael Smith, which I thought was wonderful, very well attended. Over 1,000-something people watched it on social media. So then we did our community meetings, which we brought back last month. We did our last one this Tuesday. Enormous number of people reaching out to that on social media. And our evening coffees, which we will have the last Sunday of this month, the last Sunday of July here at our home in the backyard with safe distancing in place. And if it rains, it will be postponed. We are going to begin our newest initiative, which is our community tent events. We will be going to each community where you'll see a yellow tent with our signs that you'll be able to stop and ask any questions, get anything you need, whatever you need resolved. I will be out there, as opposed to knocking on every single door, and some people are uncomfortable with that. We may still drop information like emergency phone cards to doors, but I do not think it's quite yet the time to be knocking on the doors and engaging in conversations because some are still very uncomfortable with that, although others are not. So to still give that community outreach, we will be out there in our tents reaching out to everyone who needs us. And again, I am very, very grateful to those who are allowing me to go into their communities and to set up a place for the tent. If anyone would like to do that for us, we would be very grateful, and it will help us help you. The Yardway site is staying open. It was funded again. I just thought I'd throw that out there. We get until next July 1st. We're looking for a secondary alternative and something that makes everyone happy with its location and its ability to access and get out of without littering some of the area. The Delaware Solid Waste Authority has opened a new recycling center at 470 Corporate Boulevard, which is in the Pencader Commons off of 896. As on our Facebook and our email blasts, we also post where you can get testing. Testing is available through Newcastle County. You can type in delaware.curativeinc.com, or in the state, it's de.gov/get tested. And now there are 3 testing sites, one at each Walgreens in each of the 3 counties. The Newcastle County site is in Middletown at 700 South Ridge Avenue. So that gives us plenty of opportunities for testing. Keep getting tested. I think it's the smartest and best way for us to know how we can control the spread. The LabCorp is also doing antibody tests. You go there, I think you go through your insurance and it's like $10 or something, but that's the antibody test. The tests that the state and the county and even Walgreens are doing are the tests to see if you're actively infected by the COVID virus. The antibody test, it means you already have it and you have the antibodies in your system, which would help you hopefully be stronger in resisting getting the COVID virus in the future. The back to school plan that was presented by the governor had basically 3 levels: green, yellow, and red. Green, they would go through if there was no spread. Yellow would be more like a medium spread, and red would be if there was an active spread. They would stop schools. I thought it was very exciting, and I thought it was a wonderful plan, path forward when the governor had announced our task force of the legislators to go and to have input. Sometimes task force are more like babysitter sessions. Sometimes they're actually something very productive. I think I heard it best by Representative Smith. He was concerned that, was the task force to sell a plan that they already had, or was it to create a plan or affect and to formulate a plan? It seemed like maybe it was to sell something, and some are a little concerned about that. I personally feel teachers and parents need to have more involvement and more communication in that plan, but it is out there now, so read it, give me your input, and I will do my best to support what the people in our community want. Red Clay School Board has their elections from 7 a.m. to 8 p.m. on Tuesday, July 21st. The people in our area can vote at Dickinson High School, Forest Oak, or McCain High Schools. All you need to do is reside in the Red Clay district. And the last effort by a couple people on the board of Red Clay to eliminate SROs in the school and use the money for mental wellness was defeated, both in Red Clay and in Christina. Both have decided they're keeping their SROs, which I think was the right decision. The school boards both have found the safety and welfare and needs of the children and the parents was enhanced by the SROs. HB 100, which I was a sponsor of in the House this year, did actually create an initiative to fund a better environment for mental health for our children in our schools. It was there to be voted on this year and funded, and would have started in September. The issue is with COVID shutting down the legislature, we never got to vote on that particular bill. If I'm fortunate enough to be reelected with your support, I will be back there in January sponsoring the bill again to once again get it out of the House. I do believe the mental health of our children is extremely important, and during the COVID virus and the other issues that have socially affected our community, I believe we need to have attention for our children's mental and physical well-being, and those mental health professionals will absolutely be helpful to that. So with that, again, I do thank you for allowing me to serve you as your representative in the 21st Representative District. I again thank you for trusting me. I do the best I can to be there to help you stay safe and stay healthy. Thank you.